What is heart failure? Heart failure, also known as congestive heart failure, is a condition that develops when your heart doesn't pump enough blood for your body's needs. This can happen if your heart can't fill up with enough blood. It can also happen when your heart is too weak to pump properly. The term heart failure does not mean that your heart has stopped. However, heart failure is a serious condition that needs medical care. More than 6 million adults in the United States have heart failure, according to the Centers for Disease Control and Prevention. Children can also have heart failure, but this health topic focuses on heart failure in adults. Heart failure can develop suddenly, the acute kind, or over time as your heart gets weaker, the chronic kind. It can affect one or both sides of your heart. Left-sided and right-sided heart failure may have different causes. Most often, heart failure is caused by another medical condition that damages your heart. This includes coronary heart disease, heart inflammation, high blood pressure, cardiomyopathy, or an irregular heartbeat. Heart failure may not cause symptoms right away, but eventually you may feel tired and short of breath and notice fluid buildup in your lower body, around your stomach, or your neck. Heart failure can damage your liver or kidneys. Other conditions it can lead to include pulmonary hypertension or other heart conditions, such as an irregular heartbeat, heart valve disease, and sudden cardiac arrest. Your doctor will diagnose heart failure based on your medical and family history, a physical exam, and results from imaging and blood tests. Currently, heart failure is a serious condition that has no cure. However, treatments such as healthy lifestyle changes, medicines, some devices, and procedures can help many people have a higher quality of life. Visit the Living With section to learn more. Visit the Heart Truth to learn about heart disease in women. Symptoms. Symptoms of heart failure depend on the type of heart failure you have and how serious it is. If you have mild heart failure, you may not notice any symptoms except during hard physical work. Symptoms can depend on whether you have left-sided or right-sided heart failure. However, you can have symptoms of both types. Symptoms usually get worse as your heart grows weaker. Heart failure can lead to serious and life-threatening complications. One of the first symptoms you may notice is feeling short of breath after routine activities like climbing stairs. As your heart grows weaker, you may notice this while getting dressed or walking across the room. Some people have shortness of breath while lying flat. Older adults who do not get much physical activity may not experience shortness of breath. However, they may feel tired and confused. People who have left-sided heart failure may have the following symptoms: trouble breathing, cough fatigue, extreme tiredness even after rest, general weakness, bluish color of finger and lips, sleepiness and trouble concentrating, inability to sleep lying flat. People who have right-sided heart failure may also have the following symptoms: nausea, feeling sick in the stomach, and loss of appetite, pain in your abdomen, area around your stomach, swelling in your ankles, feet, legs, abdomen, and the veins in your neck, needing to pee often, weight gain. What problems can heart failure cause? Heart failure can cause some serious problems. Kidney or liver damage is caused by reduced blood flow and fluid buildup in your organs. Fluid may build up in or around your lungs. Malnutrition from nausea and swelling in your abdomen, the area around your stomach, can make it uncomfortable for you to eat. Reduced blood flow to your stomach can make it harder to absorb nutrients from your food. Other heart conditions such as an irregular heartbeat, leaking heart valves, or sudden cardiac arrest can be caused by heart failure. Pulmonary hypertension may also be caused by this condition. Diagnosis. How will I find out if I have heart failure? Your doctor will diagnose heart failure based on your medical history, a physical exam, and test results. Bring a list of your symptoms to your appointment, including how often they happen and when they started. Also, bring a list of any prescription and over-the-counter medicines you take. Let your provider know if you have any risk factors for heart failure. You may also be referred to a cardiologist for these tests and treatment. A cardiologist is a doctor who specializes in diagnosing and treating heart diseases. Diagnostic tests and procedures, blood tests. Your provider may order blood tests to check the levels of certain molecules, such as brain natriuretic peptide external link, BNP. These levels rise during heart failure. Blood tests can also show how well your liver and your kidneys are working. Tests to measure your ejection fraction. Your provider may order an echocardiography, echo, or other imaging tests to measure your ejection fraction. Your ejection fraction is the percent of the blood in the lower left chamber of your heart, the left ventricle, that is pumped out of your heart with each heartbeat. Ejection fraction measures how well your heart pumps. This helps diagnose the type of heart failure you have and guides your treatment. If 40% or less of the blood in your left ventricle is pumped out in one beat, you have heart failure with reduced ejection fraction. If 50% or more of the blood in your left ventricle is pumped out in one beat, you have heart failure with preserved ejection fraction. If your ejection fraction is somewhere in between 41 to 49%, you may be diagnosed with heart failure with borderline ejection fraction. Other tests. Other imaging tests show how well your heart is working, such as a cardiac CT scan, cardiac MRI, or nuclear heart scan. You may also need cardiac catheterization with coronary angiography to look inside the arteries in your heart and see if they are blocked. Tests for your heart's electrical activity may also be necessary. This might include an electrocardiogram, EKG, or a Holter or a vent monitor that you wear for 24 to 48 hours or more while going about your normal activities. A stress test measures how much exercise your body can handle and how well it works during physical activity. Some heart problems are easier to diagnose when your heart is working hard and beating fast. Causes and risk factors. Long-term or chronic heart failure is often caused by other medical conditions that damage or overwork your heart. Sudden or acute heart failure can be caused by an injury or infection that damages your heart, a heart attack, or a blood clot in your lung. To understand heart failure, it helps to know how the heart works. The right side of your heart gets oxygen-low blood from your body. It pumps the blood to your lungs to pick up oxygen. The left side of your heart pumps oxygen-rich blood to the rest of your body. Long-term or chronic heart failure is often caused by other medical conditions that damage or overwork your heart. Sudden or acute heart failure can be caused by an injury or infection that damages your heart, a heart attack, or a blood clot in your lung. To understand heart failure, it helps to know how the heart works. The right side of your heart gets oxygen-low blood from your body. It pumps the blood to your lungs to pick up oxygen. The left side of your heart pumps oxygen-rich blood to the rest of your body. What causes left-sided heart failure? Left-sided heart failure is more common than right-sided heart failure. There are two types of left-sided heart failure, each based on how well your heart pumps. This measurement is called the ejection fraction. The diagnosis section has more information about ejection fraction. In heart failure with reduced ejection fraction, HREF, the left side of your heart is weak and can't pump enough blood to the rest of your body. Chronic conditions that damage or weaken the heart muscles are the main cause of heart failure with reduced ejection fraction. For example, coronary heart disease or a heart attack can prevent your heart muscle from getting enough oxygen. Other causes of this type of heart failure include faulty heart valves, an irregular heartbeat, or heart diseases that you are born with or inherit. In heart failure with preserved ejection fraction, HFpEF, the left side of your heart is too stiff to fully relax between heartbeats. That means it can't fill up with enough blood to pump out to your body. High blood pressure and other conditions that make your heart work harder are the main causes of heart failure with preserved ejection fraction. Conditions that stiffen the chambers of the heart, such as obesity and diabetes, are also causes of this type of heart failure. Over time, your heart muscle thickens to adapt, which makes it stiffer. The diagnosis section includes more about heart failure with preserved or reduced ejection fraction and how doctors diagnose it. What causes right-sided heart failure? Over time, left-sided heart failure can lead to right-sided heart failure. In right-sided heart failure, your heart can't pump enough blood to your lungs to pick up oxygen. Left-sided heart failure is the main cause of right-sided heart failure. That's because left-sided heart failure can cause blood to build up on the left side of your heart. The buildup of blood raises the pressure in the blood vessels that carry blood from your heart to your lungs. This is called pulmonary hypertension, and it can make the right side of your heart work harder. Congenital heart defects or conditions that damage the right side of your heart, such as abnormal heart valves, can also lead to right-side heart failure. The same is true for conditions that damage the lungs, such as chronic obstructive pulmonary disease, COPD. What raises my risk for heart failure? Many things can raise your risk of heart failure. Some things you can control, such as your lifestyle habits, but many others are out of your control, including your age, race, or ethnicity. Your risk of heart failure goes up if you have more than one of the following. Aging can weaken and stiffen your heart. People 65 years or older have a higher risk of heart failure. Older adults are also more likely to have other health conditions that cause heart failure. Family history of heart failure makes your risk of heart failure higher. Genetics may also play a role. Certain changes or mutations to genes can make your heart tissue weaker or less flexible. Unhealthy lifestyle habits, such as an unhealthy diet, smoking, using cocaine or other illegal drugs, heavy alcohol use, and lack of physical activity, increase your risk of heart failure. Heart or blood vessel conditions, serious lung disease, or infections such as HIV or SARS-CoV-2 raise your risk. This is also true for long-term health conditions such as obesity, high blood pressure, diabetes, sleep apnea, chronic kidney disease, anemia, thyroid disease, or iron overload. Cancer treatments such as radiation and chemotherapy can injure your heart and raise your risk as well. Atrial fibrillation, a common type of irregular heart rhythm, can also cause heart failure. Black and African American people are more likely to have heart failure than people of other races, often have more serious cases of heart failure, and experience heart failure at a younger age. Heart failure is common in both men and women, although men often develop heart failure at a younger age than women. Women more commonly have heart failure with preserved ejection fraction, HFpEF, which is when the heart does not fill with enough blood. Men are more likely to have heart failure with reduced ejection fraction, HFrEF. Women often have worse symptoms than men. Can heart failure be prevented? You can take the following steps to lower your risk of developing heart failure. The sooner you start, the better your chances of preventing or delaying the condition. Adopt a heart-healthy lifestyle. Choosing heart-healthy foods, aiming for a healthy weight, getting regular physical activity, quitting smoking, and managing stress can help keep your heart healthy. Limit or avoid alcohol and do not use illegal drugs. Work with your healthcare provider to manage conditions that raise your risk of heart failure, such as diabetes, high blood pressure, and obesity. Can heart failure be prevented? You can take the following steps to lower your risk of developing heart failure. The sooner you start, the better your chances of preventing or delaying the condition. Adopt a heart-healthy lifestyle. Choosing heart-healthy foods, aiming for a healthy weight, getting regular physical activity, quitting smoking, and managing stress can help keep your heart healthy. Limit or avoid alcohol and do not use illegal drugs. Work with your healthcare provider to manage conditions that raise your risk of heart failure, such as diabetes, high blood pressure, and obesity. Treatment heart failure has no cure, but treatment can help you live a longer, more active life with fewer symptoms. Treatment depends on the type of heart failure you have and how serious it is. Your healthcare providers may include a cardiologist, a doctor who specializes in treating heart conditions, nurses, your primary care provider, pharmacists, a dietitian, physical therapists, and other members of a cardiac rehabilitation team, and social workers. Healthy lifestyle changes. Your provider may recommend these heart-healthy lifestyle changes alone or as part of a cardiac rehabilitation plan. Lower your sodium salt intake. Salt may make fluid buildup worse. View our tips to reduce salt and sodium fact sheet. Aim for a healthy weight since extra weight can make your heart work harder. Get regular physical activity. Ask your healthcare provider about how active you should be, including during daily activities, work, leisure time, sex, and exercise. Your level of activity will depend on how serious your heart failure is. Sometimes, your provider might recommend outpatient cardiac rehabilitation services to improve your exercise level and reduce your risk factors. Quit smoking. Smoking and Your Heart has for more information. For free help quitting smoking, you may call the National Cancer Institute's Smoking Quit line at 1-877-44-YOU-QUIT, 1-877-448-7848. Avoid or limit alcohol. Your provider may recommend that you limit or stop drinking alcohol. You can find resources and support at the National Institute on Alcohol Abuse and Alcoholism's Alcohol Treatment Navigator. Manage contributing risk factors. Controlling some of the factors that may worsen heart failure, like blood pressure, heart rhythm, and anemia, will often improve heart health. Manage stress. Learning how to manage stress and cope with problems can improve your mental and physical health. Relaxation techniques, talking to a counselor, and finding a support group can all help lower stress and anxiety. Get good quality sleep. Sleep disorders such as sleep apnea are common in people who have heart failure. Treating your sleep disorder helps improve your sleep and may help improve your heart failure symptoms. Read about healthy lifestyle changes in heart-healthy living. Read about healthy lifestyle changes in heart-healthy living. Medicines left-sided heart failure. The following medicines are commonly used to treat heart failure with reduced ejection fraction. Medicines that remove extra sodium and fluid from your body, including diuretics and aldosterone antagonists, such as spironolactone, lower the amount of blood that the heart must pump. Very high doses of diuretics may cause low blood pressure, kidney disease, and worsening heart failure symptoms. Side effects of aldosterone antagonists can include kidney disease and high potassium levels. Medicines to relax your blood vessels makes it easier for your heart to pump blood. Examples include ACE inhibitors and angiotensin receptor blockers, ARBs. Possible side effects include cough, low blood pressure, and short-term reduced kidney function. Medicines to slow your heart rate, such as beta blockers and ivabradine, make it easier for your heart to pump blood and can help prevent long-term heart failure from getting worse. Possible side effects include a slow or irregular heart rate, high blood pressure, and fuzzy vision or seeing bright halos. Newer medicines, including 2 new groups of medicines approved to lower blood sugar in patients with diabetes, called sodium glucose cotransporter 2, SGLT2 inhibitors, and glucagon-like peptide, GLP agonists. They may also reduce heart failure hospitalizations. Their use in treating heart failure is currently being studied. Digoxin makes your heart beat stronger and pump more blood. This medicine is mostly used to treat serious heart failure when other medicines do not help improve your symptoms. Side effects may include digestive problems, confusion, and vision problems. Currently, the main treatments for heart failure with preserved ejection fraction are diuretics. Your doctor also may prescribe blood pressure medicines to help relieve your symptoms. Right-sided heart failure. If you have right-sided heart failure, your doctor may prescribe 2 types of medicines. Medicines that remove extra sodium and fluid from your body, including diuretics and aldosterone antagonists such as spironolactone, lower the amount of blood that the heart must pump. Very high doses of diuretics may cause low blood pressure, kidney disease, and worsening heart failure symptoms. Side effects of aldosterone antagonists can include kidney disease and high potassium levels. Medicines to relax your blood vessels make it easier for your heart to pump blood. Examples include angiotensin-converting enzyme inhibitors and angiotensin receptor blockers. Possible side effects include cough, low blood pressure, and short-term reduced kidney function. Procedures and surgeries. If you have heart failure with reduced ejection fraction and it worsens, you may need one of the following medical devices. A biventricular pacemaker, also called cardiac resynchronization therapy, can help both sides of your heart contract at the same time to relieve your symptoms. A mechanical heart pump, such as a ventricular assist device or a total artificial heart, may be used until you have surgery or as a long-term treatment. An implantable cardioverter defibrillator, ICD, checks your heart rate and uses electrical pulses to correct irregular heart rhythms that can cause sudden cardiac arrest. You may also need heart surgery to repair a congenital heart defect or damage to your heart. If your heart failure is life-threatening and other treatments have not worked, you may need a heart transplant. For people with heart failure and preserved ejection fraction, there are no currently approved devices or procedures to improve symptoms. Researchers are continuing to study possible treatments. Living with heart failure. If you have heart failure, you will likely have to follow a treatment plan for the rest of your life. Even with treatment, heart failure often gets worse over time. However, you can take steps to have a higher quality of life. How to manage heart failure at home. Following your treatment plan can help relieve symptoms and make daily activities easier. It also can lower the chance that you'll have to go to the hospital. Take your medicines as prescribed. Tell your provider if you have side effects from any of your medicines. They might adjust the dose or change the type of medicine you take to reduce side effects. Make heart-healthy lifestyle changes recommended by your provider. Habits can be hard to change. Let your provider know if you're having a hard time sticking with any of the changes. You may also be asked to limit the amount of salt and liquids that you drink to reduce fluid buildup. Get medical care for other conditions that can worsen heart failure. These include obesity, diabetes, high blood pressure, sleep apnea, and lung, kidney, or liver disease. Tell your provider and pharmacist about all the medicines you're taking. Taking medicines together can raise the risk of side effects. Also, certain medicines can worsen your heart failure symptoms. Know when to seek help. Watch for signs that heart failure is getting worse, such as new or worsening symptoms. Weight gain, ankle swelling, or increasing shortness of breath may mean that fluids are building up in your body. Ask your provider how often you should check your weight and when to report weight changes. Your symptoms may suddenly get worse. Ask when to make an office visit or get emergency care. Keep the following handy: phone numbers for your provider, the hospital, and someone who can take you for medical care. Directions to the doctor's office and hospital. A list of all the medicines you're taking. Get support and know your options. Living with heart failure may cause fear, anxiety, depression, and stress. Talk to your healthcare provider or a professional counselor. They can help you find or learn ways to cope. Get treatment for depression. If you are depressed, your provider may recommend medicines or other treatments that can improve your quality of life. Join a patient support group. You can learn how other people who have similar symptoms have coped with them. Your provider may be able to help you find local support groups, or you can check with an area medical center. Seek support from family and friends. Letting your loved ones know how you feel and what they can do to help can help lower your stress and anxiety. Know your treatment options. If your heart failure is very serious, palliative or hospice care can improve your quality of life and help make your daily life more comfortable. This type of care focuses on managing your symptoms, helping you avoid unnecessary tests or treatments, and providing support to your loved ones.